Hi, I am Dr. Kranthi Shilpa, working as consultant at Care Hospitals, Banjara Hills. Today we will be discussing about the topic hysterectomy, what are the indications of hysterectomy and what are the different methods available to perform an hysterectomy. So what do you mean by hysterectomy? Hysterectomy, it is a surgical procedure of removal of the uterus. So uterus is the place where the baby grows. Uterus is the womb where the baby grows during her pregnancy. And uterine lining is responsible for the normal periods that occur during every month during her reproductive age group. So performing an hysterectomy means the woman no longer menstruate and no longer carry her own baby. So what are the indications of hysterectomy? Uncontrolled vaginal bleeding not responding to any of the medical treatment modalities available, pelvic inflammatory disease, chronic pelvic pain, or fibroids. Fibroids, these are the tumors of the uterus. These are benign tumors, not malignant, or any cancers of the uterus, cervix or vagina. This is one of the indication for hysterectomy. And next comes the adenomyosis, where the endometrial lining, where the uterine lining is projected into the myometrium, which causes excessive pain during her periods. Even after periods also, she may have excessive pain. That is one of the indication for hysterectomy. Next comes the endometriosis, where the uterine endometrial lining is present outside the uterus. That is on the bowels, tubes, ovaries and all, which causes severe dysmenorrhea during her periods. Last but not the least is the cancers. Cancers of uterus, cervix, vagina is one of the indication for hysterectomy. Next comes the uterine prolapse, where the uterus is present outside the normal genital area due to lack of strength to the supporting structures. Uterus may be there outside, causing uterine prolapse. It is one of the indication for hysterectomy. So what are the types of hysterectomy? Depending on the cause, extent of hysterectomy differs. There are three types of hysterectomies. One is the subtotal hysterectomy, where we will remove only the uterus. Total hysterectomy, where we will remove the uterus along with the cervix. And next comes the abdominal hysterectomy with salpingo-oophorectomy, where we will remove the uterus, cervix, tubes and ovaries. These are the people where hormone replacement therapy is required. So what are the different procedures by which we can do hysterectomy? It is by abdominal hysterectomy or laparoscopic hysterectomy. Abdominal hysterectomy means giving a small incision on the abdomen somewhere around 5 to 7 centimeters, through which we'll remove the uterus by cutting an abdomen. So it is usually done under spinal anesthesia, and post-operative recovery is a bit late. It may take somewhere around 1 to 2 weeks, and blood loss may be little more. Next comes a total abdominal laparoscopic hysterectomy, where we'll remove the uterus through the normal birth passage, and we'll put small abdominal ports somewhere around 5 mm to 1 centimeter ports on the abdomen, through which we'll clamp and cauterize, and we'll try to remove the uterus from the normal birth passage. So laparoscopic hysterectomy is more advanced, and pain, post-operative recovery is very much good, and pain after surgery is also very much less. Post-operative recovery is too good for laparoscopic hysterectomy. Thank you.